We're now looking to the Republican side for purposes of an amendment. Mr. Sullivan, you have an amendment that's been out for 2 hours. There are copies at the desk, and it's to this title.
Yes, sir.
Mr. Chairman, I reserve a point of order.
The gentlelady from Colorado reserves a point of order. The amendment qualifies. The clerk will report the amendment.
Amendment offered by Mr. Sullivan of Oklahoma. At the end of Title V of Division C, add the following. Subtitle
Without
F.
objection, the amendment will be considered as read. And
Mr. Chairman, I'd seek to reserve a point of order on the amendment.
we already have, so there are two reservations of points of order. Mr. Sullivan, you're recognized now for 5 minutes.
Thank you, Mr. Chairman. I have an amendment to the amendment in the nature of a substitute. Mr. Chairman, I have a common sense, good government amendment today that is an important effort to stop wasteful and inefficient government spending in our health care programs. My amendment would require the Health and Human Services Secretary to conduct a study on new and old programs affected by this legislation to determine if there is any program or if there is any program duplication. Under my amendment, the Secretary must write a report on the study within a year of enactment of this bill. After writing that report, the Secretary would be required to eliminate any duplicative programs within 6 months. I'm particularly concerned with the number of new government programs that are created in this bill. This legislation is adding at least 31 new federal programs, agencies, grant programs, commissions, and mandates. With our nation experiencing record levels of debt, we need to be taking a hard look at waste and duplication on our government programs, especially when we are adding to them as this bill does. Also, with the CBO stating yesterday that this legislation will increase, not reduce, public spending on health care, we need to find taxpayer savings where we can. Just this week, it was reported that our budget deficit has already topped $1 trillion for the year and was on pace to grow to nearly $2 trillion by the fall. I think we can all agree that inefficiency, duplication, and wasteful spending are having devastating consequences for the fiscal health of our country. My amendment would help stop any wasteful or duplicative spending in this legislation. I believe that if we are all going to keep putting new spending and programs on the table, then we absolutely must have a mechanism to take old things off. My amendment provides the mechanism to do just that. Again, all my common sense amendment does is require a simple study on duplication of federal programs in this bill and allow the Secretary to take action on inefficient programs. I think everyone can agree to this, especially in light of the deficits we are facing in this country. And I yield back.
Chairman yields back his time.
Chairman, I withdraw my reservation.
The chair recognizes himself on the amendment. I am certainly sympathetic to what you're suggesting, that we make wise investments and not have duplicative efforts. But I'm worried about this amendment. The underlying bill requires the Secretary to develop a national prevention and wellness strategy, which I think would address your concern. That strategy requires the Secretary to inventory current prevention and wellness activities. It requires her to identify specific national goals and objectives and set priorities for future initiatives. The Secretary must also develop a plan for addressing these priorities, taking into account unanswered research questions and unmet prevention and wellness needs. And this report is to be submitted to Congress no later than 1 year after enactment of this provision. What differs is your amendment, which would require a study, which we also have, but then authorizes the Secretary to terminate programs as she deems appropriate without further action by the Congress. And I feel that the Congress ought to be able to use its own judgment before programs that we've authorized are terminated by anybody in the executive branch. I'm ready to terminate any program that's unnecessary and redundant and not cost effective, but I want the Congress to do it. I don't think it's appropriate to delegate that authority to the Secretary, and for that reason I would oppose the amendment. Mr. Barton.
Mr. Chairman, I rise in support of the Sullivan Amendment. We thought this was the single most innocuous good government amendment that we could offer in good faith to show we were going to try to work to improve the bill without destroying any of the underlying principles that the majority is embedded in it. This amendment's fairly simple. It says that the Secretary of Health and Human Services, who, by the way, is appointed by President Obama, within a year has to look at all the new programs in this Division A of the bill. So we're trying to stay within the scope of the procedure the chairman has organized, and send a report to the Congress. And then if in that study the Secretary determines that some of the programs are duplicative, and we even changed this a little bit, we said to the maximum extent appropriate, terminate other federal programs within this division. So we even gave a little leeway there. If you look at your underlying bill and you create a brand new commissioner who can terminate people's individual health insurance without any congressional act, I would think you could accept that a HHS secretary under this division of your new programs, your new bill, could to some extent terminate duplicative grant programs. Duplicative. So I would, especially to my Blue Dog friends who are trying to do a little cost containment in the bill, this doesn't guarantee cost containment, but it at least directs the Secretary and gives the Secretary the authority, if you have duplicative programs under this division, to try to save some money. I think it's an innocuous amendment and could be unanimously supported.
Gentlemen, yield to me.
Sure.
Well, it just points out that both sides have now misjudged the acceptability of their respective amendments. First of all, you made a statement that I don't think is accurate. We don't give the authority to the Secretary to terminate anybody's insurance whatsoever. But this amendment...
you give the commissioner, you create a new health commissioner that has that authority.
This amendment, I'm not sure that that's accurate. I doubt it, but we could look at that.
Well, we can check it. It's factual.
Because I don't think we ought to give the Secretary this kind of power, any Secretary. And you pointed out the Secretary at the present time has been appointed by President Obama. If you were willing to say that the Secretary would not have the ability to terminate the programs, but ask Congress to terminate them, I'd have no problem with them. I don't think the amendment's even necessary because we have that in our underlying bill. But what bothers me and why I can't support this amendment is authorizing the Secretary, even using her best judgment, to replace the judgment of members of Congress that authorized the program to terminate these various efforts. Well, her recommendation would carry a great deal of weight, but I don't think Congress ought to give that kind of authorization to the executive branch.
Reclaiming my time, Mr. Chairman, I appreciate that, but then we have a fundamental difference of opinion about separation of powers under the Constitution. The Congress legislates, the executive branch administers. What you're saying is you don't trust President Obama's own appointees to administer the programs that you put into place. You
legislate.
You want to micromanage. I mean, secretaries have the authority right now to terminate programs, and presidents have the authority even when Congress appropriates, if not to spend those funds if they don't agree with the intent of the Congress. So we're just trying to prevent duplicative programs. This is a massive change of the health care system as we know it, and we thought this amendment was fairly straightforward. If inadvertently, let's give you the benefit of the doubt that you're not intending to create duplicative programs. If just inadvertently you give some explicit authority to this secretary to pick and choose and try to eliminate duplication. I don't think that's partisan. I think that's good management and good sense, but obviously we have a difference of opinion. So I would support the Sullivan Amendment and yield back.
Further discussion on the Sullivan Amendment? Mr. Shadegg.
Mr. Chairman, I'll be brief, but I simply want to raise the issue that I think Mr. Barton just raised, which is what authority there is to do away with plans and whether the Commissioner has the authority to do so. I believe at page 16, beginning with line 20, grace period for current employment-based health plans, The bill, by its language, says that a plan can exist, a current plan, a health care plan for employer-provided health care may continue to exist for 5 years without meeting the requirements, the minimum requirements prescribed by the Health Care Benefits Advisory Committee for that 5-year period. At the end of that 5-year period, if it does not meet those requirements, it goes away. So as I understand it, the Commissioner does have the authority to wipe out all existing plans at that point in time. And I believe that's what Mr. Barton was referring to. It's not something we need to go into now. We can go into it at a later point. Indeed, I'd be happy to ask for clarification from counsel at a later point in time. With that, I'll be happy to yield to Mr. Rogers of Michigan.
Thank you. And Mr. Shattuck and I think others, you point to the huge problem of dropping a 1,200-page bill where I think nobody's read the bill clearly. And maybe, Mr. Chairman, you haven't got to page 44 under Section B of that page, suspension of enrollment of individuals under such plan after the date of Commissioner notifies the entity of determination. So not only can you do a whole plan, which is in a later section in the bill, under this page, they can actually go to an individual and throw you off a plan. So it is clearly under the bill of which you have written that they can throw people off the plan, and you've given not only the Secretary, but this new Health Choices Commissioner. And that's what I think is so dangerous. And if you're concerned that they can do that, Mr. Chairman, it sounded like you were, maybe we ought to postpone this hearing and actually allow us to go through this bill and find those instances where you have empowered the federal government to throw individuals off their bill. And by the way, there's nothing in here that even says you have to notify them. It's pretty dangerous stuff, and I'm going to agree with Chairman Waxman that this is a concern, and we ought to work together to get it out of the bill.
Will the gentleman yield? Will the gentleman yield?
It's my time, and I'd be happy to yield to the gentleman from Oregon.
I just want to follow up and maybe enter into a colloquy with my colleague from Michigan, because are you saying that this unelected commissioner can do something to throw people out of their insurance plans without notification, perhaps? Is that what you were saying?
Under the bill that is written and has been presented to us yesterday, that is exactly what they can do. The suspension of enrollment of individuals under any plan after the date the commissioner notifies the entity, they can do it.
So they can do that, and the amendment before us simply says if there are duplicative grant programs, that the Secretary should try and eliminate that duplication, right?
That would be correct, sir.
But we're hearing that shouldn't be allowed. That's too much of a delegation of authority. But yet in the bill they can kick people off a plan without.
And not only do they kick them off the plan, sir, but under the second paragraph down, they can also suspend payment to the entity under health insurance without notification.
Gentlemen, yield to me. Mr. Shattuck.
I'd be happy to yield to the chairman.
I think that what's being raised is a red herring, and let me tell you why. We allow the commission to look at the insurance plans to be sure that they meet the requirements under the law that this bill would promote. For example, if an insurance plan were discriminating against people based on pre-existing condition and they refuse to make a change in that plan would not be qualified to be operated. That is the power that's given, not to say to individuals that they can no longer get insurance. No one would be for that. But we're not talking about that section of the bill. We're talking about a different section of the bill.
The chairman has pretty much unlimited time, reclaiming what limited time I have left, and having in the past been criticized for consuming all of the time I'm given. Let me simply just say that I appreciate the gentleman's explanation, but that does not appear to be the words of the bill. The words of the bill seem to indicate that plans must go out of existence by a ruling of the commissioner at a certain point in time, and that seems to be in the commissioner's discretion. And the language raised by Mr. Rogers makes it pretty clear, at least from the wording of the bill. And all we can do, Mr. Chairman, given the circumstances of not having been in the process of drafting this bill, is to read from the bill. And I think the gentleman from Michigan has adequately pointed out that this allows the suspension of the enrollment of an individual under such plan. That's the wording of page 44, line 16 and 17. And I'd be happy to yield to Mr. Rogers.
Thank you, Mr. Chairman. And not only is it under the individual, but they've also done this with the later on in the bill, and I don't have the section before me that says the Secretary can do it for an entire plan and an entire company with consultation with the Health Choices Commissioner. They can actually eliminate whole plans through the company, as well as you stated out, in
I
individuals.
I appreciate,
Gentleman's time is
appreciate the gentleman for his
Chairman.
indulgence.
Mr. Chairman,
Mr. Pallone,
I yield,
you seek recognition. You're
seek
recognized.
recognition, strike the
Would
last.
you yield to me?
And yield to.
Chairman does not have unlimited time. Chairman has to abide by the same rules as everyone else. Let me just say that I disagree with the strained reading that is being offered to a section of the bill that is being used for a different interpretation than what I think the clear reading of it entails. Which one is it?
These are the remedies that they can
The remedies described in the paragraph with respect to a qualified health benefit offered by a qualified health benefit plan is they can have civil money penalties, or they can suspend the enrollment of individuals under such a plan after the date the commissioner notifies the entity of a determination that, under paragraph 1 that the plan does not qualify. That is a way to enforce the requirement that the plans be qualified. But let me just say, even if you read it differently, the issue before us, and I'll review your interpretation because I wouldn't want to give Secretary or anyone in government such enormous power, but the amendment that's pending before us by Mr. Sullivan gives the Secretary the power to terminate authorized programs that may already be appropriate, where there may be even appropriations of funds. I think Congress would want to have strong recommendations to terminate those programs. We don't disagree about that. What we disagree about in this instance, in the Sullivan Amendment, is whether the Secretary should have that power. And we may disagree on that, but I just want to make clear my reason for opposition.
Would the gentleman
Yes.
briefly,
Yes,
the Sullivan Amendment only gives the Secretary the authority to eliminate duplicative programs established by this division. If it's an existing program from a prior Congress that's not newly created in this law, this amendment does not apply.
Gentleman from New Jersey, I would ask counsel, if you would permit,
Yeah,
what would the Secretary, under the Sullivan Amendment, be able to terminate if she found it was duplicative in her opinion? Wouldn't that apply to programs within the Public Health Service Act that address prevention?
It requires the Secretary to review both the new programs and the existing programs, and then authorize the Secretary to terminate such other federal grant programs, which I would understand to be not the programs in this division, but the programs that are currently in existence.
in any case, Mr. Chairman, if I could reclaim my time, I think there's, between what counsel just read and other provisions of the bill where the Secretary is supposed to report back to us about these various programs, I think there's ample opportunity in the legislation now to have either her or the Congress subsequently terminate duplicative programs. So I just don't see the need for the Sullivan Amendment. I just think it's unnecessary given what the underlying bill says. But I'll yield to the chairman.
Well, I have nothing further to add. Gentleman, yield back his time?
Yes.
Any further discussion? If not, we'll proceed to a vote on the Sullivan Amendment. All those in favor of the amendment say aye. Aye. Opposed, no. No.
Recorded vote, please.
Gentleman asked for a recorded vote. Let's proceed to a recorded vote.
Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Rush. Mr. Rush votes no. Ms. Eshoo. Ms. Eshoo votes no. Mr. Stupak. Mr. Stupak votes aye. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mrs. Capps votes no. Mr. Doyle? Mr. Doyle votes no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky votes no. Mr. Gonzalez? Mr. Gonzalez votes no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Weiner? Mr. Weiner votes no. Mr. Matheson? Mr. Matheson votes aye. Mr. Butterfield? Mr. Melanson? Mr. Melanson, aye. Mr. Barrow? Mr. Barrow votes aye. Mr. Hill? Mr. Hill votes aye. Ms. Matsui? Ms. Matsui votes no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. Space votes aye. Mr. McNerney? Mr. McNerney votes no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley votes no. Mr. Welch? Mr. Welch votes no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Boyer? Mr. Boyer votes aye. Mr. Radonovich? Mr. Radonovich, aye.
Mr. Gordon.
Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mrs. Myrick votes aye. Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy of Pennsylvania? Mr. Murphy, aye. Mr. Burgess?
Lose this amendment. We're either
Mr. Burgess, aye.
Ross or we're going to lose Gordon or Mr. Dingle won't show.
Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Mr. Markey? Mr. Markey votes no. Mr. Dingle? Mr. Dingle votes no. Mr. Ross. Mr. Butterfield. Mr. Butterfield votes no. No. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Ross. Mr. Ross, aye.
Have all members responded to the call of the roll? Does any member wish to change his or her vote? If not, the clerk will tally the vote. Just a minute.
Chairman? How am I recorded? How am I recorded?
Mr. Boyer? Mr. Boyer is recorded as voting aye.
As an aye?
Yes, sir.
All right, thank you.
Mr. Stearns? Mr. Stearns
Mr.
votes
Stearns
aye.
votes aye.
Anyone else wish to be recognized? If not, the clerk will tally the roll. Yeah, I think so too.
On that vote, Mr. Chairman, the yeas were 29, the nays were 27.
29 to 27, the amendment's adopted.
Before I vote.